let us know what you're thinking about. That's really, really important. So give yourselves a little round of applause. I just always wanted to do that. I didn't know if it was going to work, but I'm like, yeah, I'm in charge, so I can say that. My name's Noah Dow. I work for a company called JBJ Management. You may have heard of them. I do some community engagement. Very excited to be working with the Reimagine RedBird project. As you can see, there's a lot of construction going on, which means a lot of good things are coming our way. We've already had a few people already move in, so we've got Chime Solutions here that you might have seen. We've got Jarvis Christian College. We've got Workforce Solutions. We've got the Dallas Entrepreneur Center right up here at top. And now we're really excited to welcome UT Southwestern to Reimagine RedBird. It's fantastic. I was excited when I read, I woke up one morning and on the Dallas Morning News was UT Southwestern is coming to RedBird. So we wanted to make some copies of that article, and so you'll see that that article is here for you. We want you to take it home, read it so you have all the information, but we're really excited about that. So today is a listening session. That's what today is going to be about. We're here, UT Southwestern members are here. If you're with UT Southwestern, could you just raise your hand in general? So we got a lot of UT Southwestern people here. And that's because they're really are here to listen to you. They want to know from the community what kind of services, health services that you're interested in UT Southwestern providing, and then how we can build a partnership together over the next 5 to 10 years, definitely, so we can see some real growth in this community as far as staying healthy, being healthy, having a primary care, preventative care type thing. So all sorts of things. We're just here to listen to you, though. So that's what it's going to be mostly about today. I know you might have some questions coming up, but we don't have the answers quite yet. We want to know what you guys think, okay? That's not to say we don't have any plans, so I'm excited about it. I wanted to take just a moment. I want to introduce somebody who's very important to Reimagine RedBird in general. He is an investor. He's from the community here. I had an opportunity to meet him a few years ago to find out that this guy is just an incredible, intelligent person, very wise, a mentor in some sense. So I wanted to give an opportunity for Roland Parrish, an investor here at RedBird, to say a few words if he would like. Mr. Parrish.
Good evening, everyone.
Good evening.
How's everybody? Good. I'm going to do like church and I won't do like church and I am the son of a preacher, so I may take up an offering when I finish. All I can say is I am a local businessman. I just celebrated 30 years in Dallas and feel like I'm a Texan by now. My children don't get excited when I talk about any businesses I have, but when I brought up RedBird, they like perk up and cheer. I've been at functions before, and they'll flash some of the things I do, but when they show the RedBird, like the Reimagine RedBird, people clap. So this is great for the community. I was visiting with Concord on Sunday. Pastor Carter was talking about it. So I think it's a great opportunity. Two great partners of the many partners that are here and are interested. I don't know if you know, Marriott is interested. But we have Parkland here in UT Southwest from the medical side that will plant right here in the community. And this forum tonight is for you to talk about what the community needs and what the community wants. So I think it's a great opportunity. Oh, I'm very proudful. I'm in the ranking. When I was in high school, I ran track. In college, I ran track. So I was like, what number are you, this or that? So I am the #2 investor behind Peter. And I'm proud of that. So I'm the number 2 investor. I try to stay that way. It's gaining momentum. I think you can see the momentum in the community. And I think, again, this is a great opportunity. Thanks for those kind words. But a great opportunity for the community to say what we need and what we want in the community. So thank you very much.
#2 investor, don't miss that. That's a big deal. I'm really excited about everything that's happening here. But there's another person who is absolutely instrumental to what's going on here. Is actually a representative of y'all's community, because you know and you know that this guy gets up really early, goes to bed late. He's at all the community meetings. Anytime I call him, he's like, "No, I got this thing going on, but I'll make it there for you. I'll make it there for you." So I really appreciate that. Councilman Atkins is just been an incredible councilman this entire time. I can be 100% honest with saying that this project would not happen if it weren't for Councilman Atkins being in office. That's a big deal. And I mean that, so I'm going to say it again. This project would not happen if Councilman Atkins was not our District 8 councilman. So, I really appreciate all the hard work he's done. He treats us like his baby, so I really, really appreciate that hard work. And Councilman Atkins, of course, if you want to say a few words.
Twice in 1 week.
I know, right?
Peter, great name, twice in 1 week, huh? But first, let's thank Peter Brosser again, everything starts with a imagination, right? A subliminal in your mind. And sorry for running late. I was at UT Southwestern headquarters, T-Bone Pickett, talked to all these young professionals who want to be doctors and whatever they want to do. It was probably about a couple hundred there. It was still coming when I left. And I said, I got to go to UT Southwest in the South. They all applauded, and they said they're going to come here. But UT Southwestern is something that it's imagination. You can imagine what it's all about. You can imagine what it could be. But it's imagination until we get your input to be reality. It's something that the South needs. It's something that with Peter Brosser and his investor, we would not be here today. Without the city of Dallas, we would not be here today. And without the community, we would not be here today. So this is a family. And with a family, you got some bad apples, you got some good apples, right? Mm-hmm. But we all learn how to work together as one. And that's what we're going to do. We're going to work together as one. We're going to make this a great opportunity. But let us try to stay focused tonight. This is our second rodeo in RedBird. I know we need a whole lot of other things around in the community. But this is UT Southwestern Day. They said they asking you, what can they do for you? So they want your input. And if you don't know what UT Southwestern are or who they are, look it up, Google and find out what they do. But it's a great institution that want to come south, but they want to come south because they want to make sure you have it your way. So again, you're going to have it your way. There's an opportunity to ask. And thank you for being here today. Congratulations for being here.
Of course, it's really important to thank the people who do all the hard work that can make sort of these things happen. And of course, we have to thank UT Southwestern about their decision makers and their key people and the community engagement people who came here and looked around and participated and said, this is going to be great for us. It's going to be great for the community as well, but this is also going to be great for us. And so working that way up, all the way up to the leadership, somebody's got to sign that dotted line. There's just one person's signature you might need. And so I want to introduce Dr. John Warner. Dr. John Warner is the Executive Vice President of Health System Affairs for UT Southwestern, in charge of all the doctors, in charge of all the hospitals, as I see it. He is a cardiologist as well. That is important. That's way above my head. I don't know. But I'm very impressed. I've gotten to talk to Dr. Warner a few times. Extremely intelligent man, clearly, but really saw an opportunity for UT Southwestern here. So, Dr. John Warner, appreciate it.
Thank you. It's a pleasure to be with you tonight. Thank you for being here. As has been stated earlier, we're here to listen. UT Southwestern is here to make a substantial investment in RedBird. So if you haven't read about what we're doing, we have essentially agreed to lease with Peter the entire Sears building, so 150,000 square feet, which will be the largest medical facility for us outside of our main campus at UT Southwestern. So we're looking forward to having a substantial footprint in your community, partnering with you to improve the health of those who live here in South Dallas. So tonight is about listening to what your vision for this would be. And so when we've got a whole team of people here to listen to you, and I can promise you that we'll take your input seriously. We'll have questions for you along the way, but tonight is really, we'll be quiet and just listen. And again, thank you for being here tonight. We look forward to being your neighbors, your partners in this new endeavor, and really looking forward to what was a great session Tuesday night, and I'm sure it'll be a great session tonight. So thank you, and again, I'll step back and listen to all of you. So thanks a lot.
I just got one quick shout out. He told me not to do this, but I'm going to do it anyway because it's Peter Brodsky, the owner of the mall, is here. He was at the meeting last time. Very invested in the community. And just a small thing that I wanted to share, maybe you don't want to listen to this, but I get to sit in rooms with him, and there's just a small amount of people, and some people will go, oh, we could do it faster if we could kind of cut down the cost, and we can cut down the quality, and he goes, okay, we'll take your time, because we want the best that we can possibly have. And I just personally want to put my personal endorsement behind that guy, because I've gotten to sit in rooms with him, and I believe the things he's saying, so thanks a lot, Peter Brodsky. Okay, so we're going to move on to the UT Southwestern listening session part of this. And I just wanted to go over a little bit again exactly what we're asking for. We really want to know what kind of healthcare services you would like provided to you. With that, there might be you might have some conflicts, some barriers, as in, hey, I need it to be open later. I have some kind of transportation issues. We're going to be talking about that kind of stuff as well, but we really want to focus on what kind of services you may need. What do you think is really important, whether it's specialty care, whether it's primary care doctors. So we're going to be having an open listening session. Feel free to raise your hand and talk. If you talk like 10 times today, I might stop looking at you, just so you know. I'm just playing. I appreciate any comments that you might have, but I will be asking people who haven't talked. I don't care if you raise your hand, I will point to you and be like, man, what do you think about this question? So they've learned that about me. I've also got someone here helping me out. Deborah Richards has been helping me with this entire process. She might help me if I don't know the correct medical term or something like that, or just in general. So I really appreciate Deborah Richards being here as well. We also have the architects for the building who are here, Perkins and Will. So thank Perkins and Will for being here. And they're here to listen to you as well. Before they even start drawing up their plans, they want to know what kind of healthcare services you need. So that's how important your community input is. That's how important your input is. The architects are here, UT Southwestern is here, the owner of the entire mall is here, the second-rate the number 2 investor is here. This is an important meeting. It definitely is. What you say today will matter. It's not some general, oh, let's just get out. This is going to matter in the overall design and services of UT Southwestern, so we're excited about that. So let's go ahead and jump in. We'll say if you want a drink or something in the back, you feel free to get up while I'm talking. I'm not worried about it. Yes, sir.
Could you give us like a 5-minute overview of this? Just what is going to be on the ground? Just a little bit about what the...
As far as services?
Yeah.
Well, we don't know what kind of services we might have yet, Mr. Smith. No, absolutely. So we're here to listen to what might be high priority, the top 3 to 5, and then...
Can I interject for 1 second?
Sure, absolutely.
We know, we don't, it's not that we know nothing. We know the basics. It's going to be 150,000 square feet. It's going to be day clinics, not overnight beds, so not a hospital. It's going to be mostly specialty clinics. And what we're here to find out, and it's going to be staffed by UT Southwestern doctors from the main campus. There is a deep commitment to make the patient experience here as high quality as it is on the main campus. Those are the core principles. What UT Southwestern wants to hear tonight is which services would be most helpful to the community. What are the health issues that you see in the community that are most need to be served so that they can program it properly? Does that help?
Could you say one thing about what the relationship is between UT Southwestern and Parkland?
Well, UT Southwestern and Parkland in general have a relationship in that UT Southwestern staffs Parkland. It's UT Southwestern doctors. Dr. Warner's better to talk about that.
So at UT Southwestern, our physicians staff our own hospitals that we own and operate, but we also staff Parkland and we staff Children's. So we have about 3,000 doctors working in all those locations, and our goal is to provide high quality care at every place. we've been in lockstep with Parkland all along the way in planning the RedBird investments that we will make. So Parkland will have a clinic here as well. You may have seen that. We've been making sure that what we do is synergistic, that we work together, so we're additive to each other. So not doing exactly the same things. There'll probably be a little bit of overlap as we move forward, but we meet with them every couple of weeks to make sure that what we're doing is bigger together than what we would be by ourselves.
But they are going to be separate facilities in separate parts of the
Yeah.
Within the 150,000?
No, Parkland is separate. So UT Southwestern is 150,000 square feet, and that's in the old Sears building. Parkland has leased 43,000 square feet in the former Dillard's building. And Parkland will also be open 6 to 9 months before UT Southwestern, just because it's a smaller space. It's a quicker process.
One more foundational question, I'll shut up. Will the medical staffing that exists now at Parkland and UT Southwestern on Harry Hines be sharing their time here, or are you hiring physicians and other clinicians who will work here only?
Yeah, I can't, so Parkland, traditionally, I won't speak for Parkland because I don't think, oh, they are here, so great, so maybe they can, but, so they could probably answer your question, but in general, the Parkland, the doctors that UT Southwestern will staff, the 150, will be physicians that we will be specifically working here. It doesn't mean that there might not be the occasional specialist that might go back and forth that's highly specialized, but what we'll be building is a community of physicians that will work in this facility most of the time, if not all the time. So we're working through that now, trying to make sure that we have that, and so I can let Parkland speak for Parkland.
So I'll just share that we will be hiring physicians dedicated to the RedBird Health. So we hope to hire of the community, and so that is something that we'll be working with our recruitment strategies at Parkland and our leaders in that arena. So we will be adding, we will not be moving resources.
All right. Those are good foundational questions, and I will also sit in now. No one's going to kill me.
The people who really know, they definitely set all this up, so they have all the answers. I appreciate it. So we're going to jump right into the questions, and feel free to be the first person to raise your hand. We're going to be talking for a little while. Okay? All right. I see you're quick with it.
I think behavioral health services will be very important.
Okay, sure. Behavioral health services, sure. Well, I want to start off with this question. What is your overall impression, based on what you know right now, about UT Southwestern? When you think of them, what's the first thing that pops into your mind about the types of healthcare services, the quality of the healthcare services? What do you know about UT Southwestern right now? Excellence. They do it the best. I hear you on that. Anybody else?
Quality and dedicated professionals that truly care about the patients.
Okay, great. Quality and dedicated professionals that care about the patients. Anybody else?
Teaching.
Teaching?
Teaching.
They teach other people.
Yeah. They teach doctors, they teach.
Right. One of the good things I saw that I brought up was they had, when I went to UT Southwestern's campus, I saw a bunch of kids in lab coats, in coats, in white coats, and I wanted to see where they were going. I'm sure they were getting their education on spot, getting to see some of those stuff. So yeah. Miss here in the back. No? She looked behind me.
No, I mean education, not just those that are looking to be in the medical field, but also just those that are interested in different science areas. I know when I was younger, I used to go to UT Southwestern for some courses.
Oh, for some courses, great. All right. Any other overall thoughts about UT Southwestern? Yes, ma'am.
Oh, I was going to further expand on her suggestions.
The types of services.
Yes, so when we talk about mental health, we want it to be, number one, accessible, preferably with no waiting list, because the way it works here in the southern sector is that we have to jump all types of hoops, have certain types of insurance to be able to get services. So I would like for them to be accessible for all, children, elderly, men, women, etc., that accept Medicaid. Because you're in the southern sector, a lot of the people here have Medicaid. So it would be redundant for you to bring mental services if they're not going to accept the insurance that we have.
Yeah, so accepting Medicaid, an emphasis on mental health services,
Yes,
and making that available for all ages.
yes, and we don't want to get our kids diagnosed with ADHD. We want services that are gonna do something other than give my child a pill. You know, I want solutions as opposed to pills.
Solutions as opposed to just saying, hey, you have ADHD, here's some medicine, take it.
Resources, accessible resources, because they usually give you a list. Oh, you could go here, there, and that, and you call everybody, and it's a work of art in order to get services.
She has some.
As you all are talking, please speak up because there are a lot of people that want to hear what you have to say. You don't have to scream, but you know, speak from your diaphragm so we can hear you because we're like, what? And everything you say is very important to making their UT Southwest Hospital very important, successful. So just speak up a little louder, even if you have to stand up. Just let it so we can hear you. But we did hear accessible and what else?
Except Medicaid,
Accept Medicaid.
that when we don't want a list of resources. We want
yeah.
solutions, something other than pills.
Okay. So
Counseling.
solutions to what the child or the person is coming in for.
Yes.
And not just giving a dose of medicine and saying go home. Really diagnose and explain what's really happening to the person. So be effective in their caring for the patient.
For all ages.
All ages.
Me, I love youth, so I feel that they're our vulnerable community, one of our most vulnerable communities, and they're our future. If we don't address their issues now, guess what? We're gonna have a problem.
Okay.
So, anybody else have an overall impression of UT Southwestern? Yes, sir. No, you can talk.
This is another foundational question.
Okay.
Is it conceptually designed right now to be at UT Southwestern the medical home for a person, or is it expected that the person already has a primary care physician or a home, and this is just for special?
So it's specialty.
Let's let Dr. Warren answer.
Yeah, are people expected to have a primary care physician elsewhere and just come here for specialty, or can this be someone's sort of home clinic?
I suspect it will be some of both. Part of why we're here tonight is to listen to you and hear what you have already and what you need from us at UT Southwestern. So we've done a little bit of analysis. Marcia Snyder, who's my Chief Strategy Officer there in the front, so we know that we can be a resource to the physicians that practice in this community, so we want to hear how we can do that. If there are gaps that need to be filled that we could be helpful in filling, we want to do that as well. So it would be a little of both. And we're not at the stage yet where I can give you a definitive answer, because the reality is we're getting to know you and getting to know this community, but we stand ready to do both.
Thank you for that, Dr. Warren. So, okay, we can talk more about UT Southwestern later. Let's move into more healthcare services and things like that. So, I want to talk about how you think about healthcare overall and discuss different aspects of healthcare experiences. And so, first of all, what types of doctors and medical services do you think people use most of their time for their needs? Are you usually going to primary care, or usually going to specialty? People are usually going to the emergency rooms if there's an issue. What type of services do you think that you particularly might use most? Yes, sir.
For myself, I do have a provider, but a longtime member in this community, and I've been here for a long time. I say a long time, many years. As I look around, I see that we, in this area, we do have a lot of retired people. And so I can see the problems that some of those people have in dealing with their medical problems and so forth. Which is a good thing that we have both these great universities and then the institution of Parkland coming this way, because that's a full realm, I think, that we're looking at this particular point. But my whole idea is really to kind of talk about the retired people that live in this area. And some of those, and knowing that the services that you provide, I feel like will really touch with a lot of those people. It's something that's very much needed, because in the past, anything that's I would say dire, we'd probably be coming your way in a apartment. And so now we have a place here that can handle that. And so I think we'll see a great change in the mentality of people that live in the area, of retired people, and even young people. Because, as you know, we have the high school over here. We have schools in this area, and there's always a need for this type of innovation. So thank you so very much for coming.
Yeah, absolutely, we appreciate that. So do you think in the retired community, they might be here more for specialty care?
I think so.
Situations?
I think so.
And then they might come regularly to see their doctor, whether.
You're close by, once they realize that.
Right.
Yeah, I believe they
So you
will.
think convenience, them being close by is a big deal in that as well?
Convenience is always a key.
Mhm. Okay. I saw another hand.
I was just gonna say something else to be mindful of is the language that we use in the community. Even when you listed primary services, specialty care, everyone from the community doesn't know what is a specialty service, what is like you kind of have to break that down
So
so your
education.
audience knows, or just cultural competency and just being aware that everybody doesn't have a healthcare background, everybody doesn't understand hospital healthcare language. So when you start saying, would it be specialty care, would it be this primary care, and I'm looking around the room like how many people even really know what's the difference? What falls under specialty care? Like we have to start there to educate the community, and then we can give you better feedback on what we need to do.
That's great. Do you want to take a second just to explain the difference between primary care and specialty care?
Sure.
Do you mind?
Absolutely, good question. My wife always tells me I stop talking like a doctor, not like a person. So I'll do my best. So I'm a cardiologist. That would be an example of specialty care. So specialty care is things like cardiology, cancer care, cancer screening, those types of things. So there are specialties. Primary care is, in general, is what you would see a family doctor for, someone who would be your internal medicine doctor or your family doctor or your pediatrician. Those are the buckets that most people call primary care. So that's people you see when you're well, preventing problems, or if you have sort of straightforward problems that don't require specific expertise. So like, for example, if you had high blood pressure, you would probably just see your family doctor. But if you have the high blood pressure that was harder to control, then you might see a high blood pressure specialist or a cardiologist like me. And that's kind of the difference. Same thing, you're being screened for cancer. You might see that at your primary doctor, your family doctor. If you are at high risk for cancer, or God forbid you have cancer, then you would go to a cancer specialist. Does that make sense?
Thank you.
Great. Does anybody else have any comments toward that? Yes, sir.
Me, myself, I experienced cancer, and living in this community, I had to go outside the community in order to find quality medical help for my cancer. I had to go to Irving, it was where my primary doctor was, and then I had my surgery, I had to go to Grand Prairie for the surgery for my cancer. And I feel that that's something that's going to be needed in this community, that's going to be vital in this new facility that we're talking about tonight. That will be something that the testing part, as he mentioned, and also the treatment portion of that will be key and something that we would look forward to here in this community.
So you were definitely willing to travel further to get higher quality services. Higher quality services was the most
It wasn't
important.
provided in our community, and this is bringing it in. Hopefully, this is what this is about, to bring it in, where we don't have to travel outside our community. We can come right here and get those services here, instead of having to travel to Irving or travel to Grand Prairie.
Yeah, thank you. I'm sorry about that. Anybody else have, yes, ma'am.
I would just agree. I've lived in this area for nearly all my life, but I work north, so everything I do is north. But if I'd had great care on the south, it would be easy to do that, before I get to work or at the end of the day. But when I think about what physicians are most important to me and the people that I know, it is going to be that primary care physician, but also mammography services and pediatric care as well.
Okay, yeah, absolutely. Just do you think not everybody has a primary care doctor? Which is, I guess, part of the issue. Is not everybody has a primary care. Would you guys agree with that statement, or I don't want to ask it.
I generally think that people start out with their primary care, but if they have an ongoing problem, then they spend most of their time with their specialty care physician.
Okay.
But again, pediatric care is big because we've been here a long time, we're not getting any younger, but our hope is that as the area is revitalized, younger people come in and they're going to need that type of care as well.
Absolutely. So, any other comments towards that? Yes, please.
I would say I work in women's health, and for young women who've never had a complication, they have an OBGYN, they may have an OBGYN, but they don't necessarily have a primary care physician. Because why would I haven't been sick? You know, they kind of phase out of needing a pediatrician, so their care is through an OBGYN. So, to answer your question, no, I don't think, you know, especially young people, I don't think they necessarily have it.
Do you think the attitude toward it is, I'm only going to go to the clinic if I'm sick? I'm not going to go just to get checked out? Right. No preventative. Okay, great. Anybody else have a comment?
I have a comment.
Yes, ma'am.
Okay, I also work in women's health as well. I also work for the city. Not gonna tell you what part, but I work for the city. And what I run into every day is that we're not educated. Like our pregnant moms, our young teens, our older moms who's having babies and all that good stuff is not educated. They need the education. They need a place to go. Like when I first started at this facility, I was teaching a class, and the first thing they told me is that they're not going to show up. They're only going to have like 2 people to show up. Right now in that class that I teach is more than, like my 11 o'clock a.m. class is like 40, and then my 1 o'clock class is like 50. So we have the moms and dad that actually needs the education and want the education for pregnancy, women's health, family practices, and stuff like that. So I'm just trying to figure out how we can actually get that into the community, and that's why I'm here. I'm trying to figure out how we can get this into the community because they really want it. I also, unfortunately, don't live over here, and I've only been in Texas for 2 years, but I already see that this is a big issue in our community. I live in Farmers Branch, but I'll drive way over here so I can actually educate them so they can know, hey, you do have different opportunities. You can switch doctors if you need to, if you don't feel comfortable with that doctor or midwife or whatever you need, you have the right to do so. So I'm just trying to figure out how I can get this into this community and work forward with it. Like, how can I help you guys as well?
So that's great. That actually lead me into the next question is how can doctors and medical professionals, how can they be more helpful in making people more aware of preventing and controlling health issues? How do you think medical doctors can help with that?
And helping people take action, understanding that it's kind of a two-way street. You get information and you have to do something.
Well, I think that,
No, absolutely. Go ahead.
I just think there has to be a willingness to educate, like she was saying, you know, working in women's health, I see sometimes.
Just a little loud. Sorry.
I've
Talk to
seen,
everybody.
I've been in, you know, in situations where there's a 39-week pregnant girl, 18 years old, and she's scheduled for a C-section. She's on her first baby. And I'm saying, okay, well, why are you scheduled for a C-section?
Exactly.
Well, I don't know. What? That's a major abdominal surgery that you don't necessarily need to have, and you're just scheduled for it because you are. And there's just, I just think sometimes when you have, sometimes low-income populations, there's just kind of like a churn and burn mentality with certain physicians, like, okay, let's get them in, let's get them out, let's get them in, get them out. And there's not a lot of education that goes into that. And there is a lot of miseducation. People just, you know, sometimes just thinking, oh, I just need a C-section. And that we need to stop that in this community.
So you think medical professionals, when dealing with a patient, spend more time educating them about what process they're going to, what options they have,
Yes.
not just a turn and burn kind of system.
Yes.
Make sure that you're educating them on their health while you're taking care of them. Yes.
Given the paper.
Oh, I'm sorry.
Go ahead.
I was going to say, I also think that utilizing community health workers will help the physicians a lot, because the time that the physicians can't spend with patients, if you have the community health workers who can, when you say it's a two-way thing, it's a give and take, and we have to work together, I think you utilize your community health workers to fill that gap, to maybe do some home visits, some follow-ups, and keep that line of communication open with the patient. And I think that whenever the health systems really get into and realize the value of community health workers, then we'll see better patient outcomes.
Okay. So having community health workers fill the gap between those positions, that's great. Yes, Ms. Booth? Sorry. You let me know.
Okay, so yes, options. Don't just tell me I need a C-section. Explain to me why. You know, and, you know, like in my case, I think she was talking about me. You know, because I was 19 when I had my first child, well, 20. But, you know, I went through, I actually did have prenatal care, so on and so forth. Right before its delivery time, my anxiety level is way out there. My blood pressure goes up. We're going to induce you. Okay, cool, I'm here, let's ride the waves. More of the story, I ended up getting cut. I got a C-section. You know, I attempted a VBAC the second time. Okay, same thing happened. I ended up with a C-section because I didn't know my rights as a patient. I didn't know that I could say, no, let's wait. You know, I'm sorry that you have to go home, but guess what? I don't want another major cut. It takes a long time to heal, not to mention all the medication. And okay, I won't talk to you about my traumas.
No.
But so moving forward, this is my third pregnancy, and I went through hell and back to try to find a doctor that's gonna do a VBAC, that's gonna aim for another VBAC. It's possible, it's doable, why not? You know, the last C-section I had was 10 years ago. Why not? Why did I have to literally call people in Plano and Fort Worth, everywhere, to be able to get a doctor that's willing to perform a VBAC? So now that I'm here, now I'm thirsty for that information. I wish I would have had that knowledge. So I think, you know, to answer your previous question, outreach. Outreach, give us information, give us options. I'm not an assembly line. This is not Amazon. You know, I'm not a product. I want to be able to deliver a child the proper way. You know, where I have less postpartum depression, this, that, and the other. So options are very important.
Options.
And education.
Yeah, absolutely. So education, options, outreach, and making sure you're being treated like a person and not a product.
Yes.
That's a big deal. Yeah, absolutely. Does anybody else have a comment about that they want to make? Anybody else want to jump in? No? You sure? Yes, sir in the back.
Hi.
Just make sure you speak up, sorry, because you're a little...
Okay, I'm listening to the conversation thus far about the education, the outreach. I currently work in case management, and I can endorse with some of what I've heard based on the population need, like the specialist need, that's on one thing. With the education, I'm hearing, and based on the demographics that's present, we do not have the younger generation. And I'm not certain if it's correct and current to say that the younger generation lacks the information that some of us present here will not have access to. And in light of that, I don't know if UT Southwestern is going to look at collaborations with the high school and junior high school, with putting out the information there. Secondly, on the aspect of communicating with the healthcare practitioner and the patient or client, well, from my experience again, I know communication do exist there, but then there is a stereotype and there is a mindset of some of the folks within the community. So it's going to be a whole change in that concept that needs to be changed in order to accept healthcare as it is.
Correct. Okay, so I have noticed in a lot of community meetings that you don't get the younger crowd. So doing that outreach to going to where the younger crowd is already going to be and making sure they're informed at a place that they're already going to be, like school, is what you're saying as well.
Yes, correct.
And, all right, thank you. Definitely, I appreciate that. Okay, so I wanted to go on to the next question, unless anybody had another comment. toward that? No, man, I see you looking at me. Okay, it's me. It's direct eye contact, I'll take that. So what are some reasons or barriers that people may have for not managing their healthcare services? Now, I know it might be some like transportation or convenience, but what are some of the other barriers that you think people may not have as far as taking care of their health regularly?
Insurance.
Cost.
Insurance?
Cost.
You're saying whether someone accepts their insurance or whether they have insurance?
Cost.
The cost, just finding out, I'm saying I don't have the money, so I'm not going to handle it, which is a big deal too. Do you have any other ones that might stick right out to you?
A lot of people have fear.
Fear? Right. If you go to the doctor, you might find out something's wrong, and that's what you don't want. You'd rather, I don't know. I think, okay. Anybody else? Do you think that's conditioned, like over time, it's continual fear saying, hey, I really don't want to know if anything's wrong or not? Why do you think people only wait before they're sick to go to the clinic? Yes?
It might be based on experience. In my experience, that's what it is. You know, I went to the hospital with the flu. Coming to find out I had a UTI, I had upper respiratory infection, this, that, and the other. And, well, the discharge paper didn't say that. So they wanted to keep me there. I said, oh, no, you're not keeping me. So I got up and started walking around. If I do have an upper respiratory infection, I'm going to, in my head, walk around and it's going to make my lungs work, blah, blah, blah. But I didn't initially want to go. I didn't want to go because I didn't want to be misdiagnosed. And guess what? It happened.
Yeah, absolutely. You don't want to be misdiagnosed when you go being charged for something that you might not want to, taking some money out of your pocket that you can use for something else. Anybody else have a question? I mean, have a comment?
I think to piggyback off what she said, there's just a mistrust with the medical community and for some people, and that just kind of prevents them from.
Mistrust. Okay. Because I had a follow-up question and now I forgot. That's why I just paused there for a second. Okay, so do you think that there's, oh yeah, sorry.
I just want to say something, but there's also like cultural biases when it comes to healthcare, and I'm just gonna put it out there. But when you're dealing with a community that's primarily African American and Hispanic, traditionally your healthcare provider is gonna be white. And so some people, there could be a disconnect because this person is not relatable. I don't really feel comfortable telling this person what all my issues are. Again, I feel like things that a patient may not share with their doctor, since community health workers, if UT Southwestern would hire from the community, people who look like me, people who think like me, speak like me, live by me, they would feel more comfortable to maybe share things with that community health worker that they really won't open up to with that doctor. Sometimes making that first appointment can be the most frightening thing that someone can do. Another thing is navigating our healthcare system. A lot of people don't know the terminology if they go on the website, try to read things, even just trying to get an appointment in a healthcare system and having to understand what's required, what do I need, and that whole process. So if we're gonna bring these two healthcare systems, Parkland and UT Southwestern, to the community, I really hope that it's structured in a way that we really do eliminate these barriers, because it's not just about creating access, because we can put the building here, but if the people don't feel comfortable enough to come in here, then what's the point? So we really have to create a culture where the community trusts the physicians, the healthcare system, and where the healthcare systems makes it comfortable for the community members to come in.
Absolutely. So creating a comfortable environment, letting somebody know, hey, you can share, it's going to be personal information. And that's particularly about when you share that with them, making sure that they're comfortable with that. Absolutely. Yeah, absolutely.
And what would make it comfortable?
I just think that some of the language, I know for sure that even when Dr. Warner said he's a cardiologist, what is that? Like, I think that we just have to be clear, that we're communicating clearly with the community. We're eliminating all these barriers on what is a PCP, what is I'm trying to think of just, I noticed for me personally, I can go to my doctor's appointment and she's using acronyms and abbreviations, And I'm like, break that down, break that down. Like, I don't have the training that you have. So just making sure that we're communicating with patients on their level, not on our level, not on the training that we've had. And so then they're more comfortable. Also, just making the walk-in, sometimes it's as simple as your reception area coming into a building. So when it's designed, make sure, I'm talking about the paint on the wall, the furniture that you choose to put into the waiting areas, having a charger station for people who come in with their cell phones, just making it feel like I'm already scared when I walk up. So if I can come in here and get greeted with a smile, and have someone speak to me with words that I understand, and be able to sit down in a comfortable chair, not feel judged, then it will make this, just that first appointment or that first visit so much easier.
And then continually, you'll say, hey, I'm comfortable going there, so I'm going to get checked up more often if I feel bad or something like that. In any kind of situation, you already know the environment. Absolutely.
Does anybody else have any other comments on?
Yeah, absolutely.
An environment that's comfortable to receive medical care, something that you've experienced that, you know, perhaps you could recommend that UT Southwestern consider as part of that overall experience and communication.
I don't want to feel like I'm going to the principal's office. If I walk in, I don't want to sit and, you know, you're sitting behind a desk and I'm sitting here. It needs to be open and an inviting environment. And just something to where there's not a barrier between you and I. Like, you know, if you're my physician, I don't want it to be like, you know, here I am sitting here, yes, yeah, you know, it just needs to be open and inviting.
Absolutely. Anybody else have any comments?
I know when I was experiencing with my doctor, sometimes he took for granted that I might have researched like the paper he had gave me. So as he explained things to me, it was like my college professor. He had the eraser in one hand and the chalk in the other hand, and he was erasing as he was going and writing. And sometimes, you know, that left me thinking that it left me behind. I couldn't wrap my head around what he was saying. So, you know, be more explanatory in their definitions of, like she was saying, of what we're going through, what we're going to be doing. This is what we'll do today, be more explicit. And also, I think it will make us more comfortable if we see more people of color, too, is what they were saying. People like ourselves in there and just not just a multitude, a rainbow. See a rainbow.
Absolutely. Anybody else have any comments for Rebecca? Yes, ma'am.
I believe the amount that the doctor spends with us. You know, yes, because sometimes, you know, I'm pregnant, so I forget everything. And if he's, okay, so yeah, you're this, you're that, okay, I'm not, back to the sibling, right? I would like for you to spend time with me and address my questions.
Absolutely.
And look,
Take your time.
because I do read body language, indicate that you really do care about my questions. So that's really, really important.
And taking the time to explain it to you, making sure that you, not saying it to you, but making sure you understand it. Those
Yes.
are two different things. Yeah, absolutely. Anyway, I saw another hand, but I forgot where it was. Okay. So let me ask this question. How open are you to having health information or services provided at a different location, let's say at church or at a health fair or at a pharmacy? How open are you to that idea? If someone were to set up a community meeting at your church or have a health fair at your, you know, at a different location, you're open to that?
Open, wide open, wide open.
What?
I believe that's the best place to have them.
What? Yes, wide open.
Yeah.
What'd you say? I'm sorry.
That's the best place to have them.
That's the best. Just it's better to actually come to you than for them. Okay. Anybody else have any follow-up? That's just a yes, overall yes. Please come to me. Come to my house. So what, is it just about convenience for you? You don't want to have to make 2 stops, you don't know when it is? Yes, I'm sorry.
Well, I think it's a good idea. I see Ms. Henry there, and I'm the president of the medical ministry at Concord, and I work for Parkland. So we work together to do a mammogram. Really was last minute, the mobile mammogram came, and those ladies came out. You know, they came out in full force with, of course, Ms. Henry backing them, but I think it was a more, Concord is an inviting environment, they're okay, it's a church. It kind of dispels a little bit of that, I'm going to the principal's office, that sort of thing. And, you know, it really made it a down-to-earth kind of welcoming environment, so they were more comfortable to come. I think we need to see more of things like that in the community, particularly with the churches.
And the community, so going to the church, like saying, setting up a vendor booth,
For
kind of
sure.
way they have in Concord,
For
should be
sure.
open to that.
And that's a way to do community outreach, you know, to get the word out, and then maybe people feel more comfortable. Okay, you know, my church is talking about it. I spoke to, you know, this lady at my church about it. I'm gonna be more willing to try it out. Because it's that first step, you know, you have to overcome the fear to get them through the door. And then once they're in, it is important to have quality professionals, like he said, a rainbow that look like you, to keep them there and educate and know the challenges of that community so you can reach that one, you know, that person.
Absolutely. Anybody else?
Will UT Southwestern participate in the Faith Community Health Initiative, where you get the churches involved with doing like the basic healthcare services, like train them to check blood pressure or train them to do just the basic things?
Oh, I'm not quite sure about that. I just didn't know, because I'm not informed. I don't know about this community group, but I'm sure that's something that we can look into. I mean, as far as we are planning this currently. So yeah, absolutely. And make sure we connect after this so I can find out more information about it. Anybody else? Because I saw some more hands and I wanted to make sure I got to everyone. Yes?
Yeah, it's not been 10 yet.
No. Absolutely. Come on.
8.
Let's start calling some of you quiet people.
So in my experience,
Yes.
go to the schools.
Right.
Get them right before they watch their kids sing, right before the PTA program shows up. That's a good time to have audiences, especially if hopefully we can get something that has to do with pediatrics, something that has to do with younger age kids, K through 12. Go to the schools. Go interrupt, of course with permission of the principal, interrupt the PTA program. Hey, let me tell you about this, da 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 da, so on and so forth, and at least you planted the seed.
Right.
Now, if the parents fail to use it, well, that's on them.
Right. So being creative with your outreach, you said like before the kids sing, you know, like going to their choir concerts, you know, all the parents are gonna be there, they're gonna see, you're like, hey, you should also get checked out, just in case. I see, so being creative with our outreach. Okay, yes?
I'm also not nice at it.
No, you're not. But I'm counting.
Just family partnership, and that's where nurses go into the homes of first-time moms, and they visit with them from pregnancy through toddlerhood. So they have a nurse in their house like every 2 weeks. And just the bond that's created between the client and the nurse, there's a lot of information that is shared with the nurse that they wouldn't necessarily share with the doctor. And sometimes they're nervous and the nurse goes to the doctor with them. You know, so I just think having that person in your home, and I'm not necessarily saying that needs to be, you know, but you were asking like why, you know, like should I come to your house? And that, you know, that they keep their visits when you have someone coming to your house. And it is a, you know, it's kind of it's a long-term thing. They're in the home for 2.5 years. So they're able to, you know, assess them during prenatal care and all that, and they can look for ER warnings, send them to the emergency room if they need to. They're after the baby's born, they can assess for postpartum depression, and then they're there to check on milestones up until the baby's 2 years old. So having someone in the home just kind of takes away that white coat syndrome, because you're just talking to your nurse, that's your friend.
So that makes you more comfortable and it's more convenient for you. You might actually be able to figure out what kind of health service you may actually need instead of being like, oh, well, it just kind of hurts or, you know, whatever.
Yes.
Absolutely. Anybody else have a question? It's so weird that everybody's staring at me, I'm going to be honest. It's just a weird thing to have happen. Anybody? No? Yes?
You know I'm needy, I'm pregnant, y'all,
I'm
leave me
getting-
alone. I would expand it, you know, because now I learn now I'm thirsty for knowledge, so now I'm learning of the first-time mom. Well, why didn't you guys offer me that service? I feel like a first-time mom, it's been 10 years. This actually feels like my first pregnancy because I'm experiencing it, everything. I'm actually gaining knowledge as I go, and at this point, your baby should be kicking. You're right, he is kicking, you know? So it would be nice if we could expand it to mothers, because, you know, as time goes by, we
Expanding what
mature.
mothers, I'm sorry?
More time with not just the firstborn. You know, if this is her 5th child and she's open to the knowledge, share it with her.
Okay, yeah. Absolutely. All right. No, I know it. And also, sorry, I don't want you to think that I'm responsible. We have people all around taking notes, and we're recording, so we're gonna be able to put this together. I just don't want you to think I should be writing stuff down. You know, I'm like, just putting it all in my head. Okay, so let me talk about hours. What about the days and the hours that someone can go to see a doctor? Is that a barrier for you? And if so, why? I'm going to, Carrie? Is it her name Carrie?
Yes, yes.
I want to pick on you.
Okay, you can pick up.
So how about the hours? Our hours, let's say a clinic was open at, I'm not sure. Tell me about it.
I live in this community, and I've been here for many years. My church is in this community. And because there's not a lot of resources out in this community, hours is important to me. You know, I work during the day, and I like to sometimes get to go to the doctor earlier. So if I have to travel farther, then that means I have to spend, get up extra early to try to get there, so I don't, you know, necessarily miss a lot of work. But if I had weekend, you know, opportunities to go to the doctor, that would be awesome.
Yeah, weekend opportunities, that would be a big deal. What about you, Miss?
I agree.
She was trying to stay quiet. Yes, ma'am.
Nights.
Nights. How late would you go to the doctor?
Well, I typically don't plan on, but around 10, for whatever reason, after around 10-ish is whenever, okay, yeah, it's getting serious, the fever's really hitting.
Yeah.
So yes, I would say at least 9.
So staying open a little later.
Yes, definitely, because we have, our demographics are 8 to 5-ish people. And then they have to pick up their kids, and then they have to go sports, this, that, and the other. By the time the dust settles, it's about 9.
Mm-hmm. So it's already, by the time, you have to set aside something else to go to get healthcare services. And the way life is set up, it's just not really convenient, really possible for you to say, hey, I'm just going to take this 3 hours out of the day or whatever it might take and get service, which is. Yeah, what about retirees? That's a great question. I know you were talking a little bit about retirees. Did you have a?
I can agree to an extent that maybe a little later into the evening, Saturdays, and I would even go as far as to say probably Sundays to a degree.
Oh yeah.
I know we're speaking of, you know, the full round now of time, 7 days. But I think for retired people, it can, the time thing is daunting. Because in a lot of cases, we may need help to get around. Maybe we don't have the transportation. And so ours is pretty much set up to the point that when we have those things that affords us, then we can make maybe a sizable thought pattern back. You know, get that time thing maybe worked out. But it's I've learned a lot tonight just listening to it. Right. So that's one thing that kind of stands out for me. Not that it bothers me that much, because I am able to get up and move around. But for some, those that can't, it can be difficult. So probably that evening thing, and try to work that time thing out.
Right.
That's really cool.
So I hear a lot about the weekends. I don't know if this is even really like a possible sort of thing, but let's just I'm polling this room. Please don't hold me to this, and don't hold me to. Would it be better if, let's say, it was open on Saturdays and Sundays, but closed on Tuesdays and Wednesdays? Or no, it's not good for you guys. You want them to be open all 7 days.
We get sick all 7 days.
Well, no, I hear you. You get sick on 7 days. I'm just curious on, sometimes these places are closed on the weekends, am I correct about that? And so, we're exchanging days as opposed to having all 7 days. But I'm seeing like a real indecision right here. Like all the time, come to my house whenever I need them.
Even if there was like one night a week, stay open late.
Okay.
And maybe,
That's what I'm
maybe open on the 3rd Saturday of the month. or the second and fourth Saturday of the month. Like, you could work it, but just give them access to some weekend hours, and maybe just a one night, one late evening, but something like that. Because like they said, everybody can't take off work. Some people, if you take off work, you don't have PTO, you're losing money, and people can't afford it. So people are always judging, do I want to go check on this stove, or do I want to pay my rent? So you have to, if you give them at least those options, because I know we can't be open 7 days a week. I don't see UT doing that.
Right.
But one night late, maybe second Saturday, something like that.
Okay, good. Please don't hold UT Southwestern that. They did not say that. I thought of that up here, and it means nothing. Please don't, that was not from this. Yes, sir.
I have a couple of suggestions. I remember, about 20 years ago, Kaiser Permanente in California did a study. They were going to open up a clinic in Oakland. And they studied all the demographics, and they realized that the waiting rooms, and this is for Perkins and Will, the waiting rooms need to be larger because the families went to the doctor in this particular neighborhood instead of just the one person. So they literally, in that facility, not all of them, made that waiting room larger and the doctor room larger because the husband, wife, and children would come to one person's medical visit.
Well, yeah.
So that's one way that you might want to think about it. The other thing is, as I think this lady was saying, make the room inviting with the color palette and all this sort of stuff. And I know WellMed right up here has a community room, or turns an existing room into a community room if someone wants to have a meeting or something. So that gets people into the facility when they're not going for something, because when we go to the doctor, we're at our worst. So if you can invite people to come in for something that isn't related to being sick, that's a way to get traffic in and still get people, seen. The other thing is, if you're there and preventing is the best medicine, then why not always have just out in the open or in some room a blood pressure deal or a blood stick, something that can be really simple that you could do, or just walk in anytime and get your blood pressure done and walk out. Because that's getting people coming to your facility, and once you get them there, you can take care of them, because our communities are what we call high touch. So we need that touch in a positive way.
Definitely, great comments. Yes, ma'am.
Just thinking about what he said with that extra space, I don't know if anybody's been over to the Baylor, I think it's a Juanita Craft Diabetes Center. When I go over there, I'm just amazed that not only are people getting service for their health issues, they have cooking demos over here, preparing healthy foods, like simple stuff, nothing big and wild, but just preventative, teaching these same people coming in here with diabetes issues on how to make lifestyle changes.
Right.
I go over again, they're having aerobics over in the room, so if we could do something like that, have something like that where I'm not only coming for my health issue, I can also take some preventative measures while I'm here, because today they're doing yoga in that community room. Today they're preparing salads in the community room. And then that patient is not only being treated medically, they're also learning while they're there, and when I get home, I just learned how to create a salad. I just learned that dancing for 10 minutes gets my heart rate. Just something like that.
Yeah, absolutely. So other activities that are health oriented but not health care services, as far as a holistic overall kind of approach on things. Yeah, absolutely. Anybody else have any comments about that? Not to pick on something.
I'm going to second the gentleman's comment. My name is Ahmad here at Price. I'm actually a primary care physician, went to UT Southwestern, so
I'll get the cards.
I'm actually from here, graduated DeSoto High School. There's open discussion about being involved in this project. My father was actually a Kaiser physician when Kaiser was right here. I used to go and be a nuisance there at that office right down the street, so I grew up in this community. And so I want to second your comment. I was actually a senior partner at Kaiser Oakland, and so, a lot of what you're saying is on point in that what we really want to start to look at is how to make this a foundational piece of the community, engage, activate, encourage, educate. So all of that will certainly be a part of this, I think. And so I think that's a on-point comment in making community and communal space. And so I think that's great feedback, and that is what we are kind of seeking to do here.
Right.
So
Absolutely. Yeah, great compliment. You know space. It's a big field. Okay. So here, I want to move on to some questions that say, what are the top 3 to 5 challenges that you anticipate UT Southwestern is going to face at RedBird or in this community? What kind of challenges do you have, whether it's wellness services, healthcare screening, overall focus, or overall programs that are focused on improving the health? You know, I know we've talked about outreach is going to be a big problem for them. Is there any other ones that speak to you besides transportation, of course, convenience, or some of the things that we are trying to fix right now by putting people closer? Yes, yes, sir.
60% of patients don't take their medicine. If you could just focus on being excellent in one thing and have whoever is following up with the patient, because medicine is almost the highest cost besides being in the hospital. If 60% of the people aren't taking the medicine the way they're supposed to, what's the use of paying all that money for nothing? You're not going to have an outcome. So we need to have people, maybe it's the health workers that you're talking about, who will follow up and say, you must take your medicine. This is how you do it. Or come up with interesting ways. Get it in the mail already in the pre-package so you don't have to do it. But there's no need of spending all that money if people are not going to use it. So that's one little thing that can be done just with extra follow-up. One person making a call maybe as a follow-up. Did you do this? Did you do this? Did you do this? That extra effort and to pay someone to do that will save a lot if the outcomes are better.
Right. Absolutely. So it's not just meeting with them, diagnosing them, prescribing them something. It's an overall taking care of their health initiative.
That's why it's so important to have a home.
Right.
In a home, your dad, your mom take care of everything that's in the 4 walls.
Right.
When you have a medical home, that means someone is going to supposedly be responsible for you until your outcome is achieved, whatever that outcome is.
Right.
So what happens is the handoff between different clinicians doesn't happen. The handoff between the primary care and the specialty care doesn't happen well all the time. When you have a third party, like maybe an imaging center, the handoff doesn't happen. The communications just by phone or fax or email or whatever isn't happening really well, and just tightening up those things don't cost anything.
The connection between this to that, just tightening up and making sure that those things are work well together, not just they work well individually. Charting a path, creating a path for somebody that says, hey, this is exactly what you do when you do it, because you don't know. I mean, and education is a big part of that.
And
making sure people know.
Communications is really bad in healthcare. I worked there for 10 years. It's bad. There's so many silos built because healthcare is not efficient in the way it's orchestrated and designed. So I just had a recent issue where it took 7 weeks for me to get an MRI because the doctor did not do the required peer-to-peer review call with the provider. So I'm stuck right in the middle for 7 weeks trying to get an MRI, which an orthopedic does every day, and I can't get it because the doctor didn't communicate with the health plan.
Right. So making sure that their communication is as top-notch as their services and everything else.
All it takes is follow through and someone who is responsible for that patient from beginning to end. Nobody is filling that role.
Absolutely. Anybody else have a question about, or have suggestions? Yes, ma'am.
Back to medication. If you're gonna prescribe me something and I'm telling you it gives me nightmares, please listen. You know, give me alternative medications if they are any. You know, because they were trying to shove Tamiflu down my throat. Don't do it. It gives me nightmares. I don't want to say what else it does, but it doesn't put me in a good place.
Yeah.
So, no, but this, but that, I can't take, I'm not gonna take it, I'm pregnant, I'm already hormonal.
You're fine, but it goes back to your point of treating you like a person and not a product kind of thing, making sure that your medication, that they're listening to you and that they understand you and the opposite as well.
Correct.
Yes, sir.
And following up with what she said, some of these medicines that they offer, prescriptions, you taking something for a rash, then they say the side effect that it'll kill you.
But you won't have a rash.
But you won't have a rash and great. So I would like to know about natural things, you know, to do like fruit, vegetables. You know, you go to Golden Corral and you see all the kids eating pizza, ice cream, cake, pies, candy. No fruits and vegetables. They need to know that growing up, so that they don't be needing all that other stuff that'll kill them. Yeah, that's my statement.
So giving alternatives to just taking medicine.
Right.
Letting them know, hey, this is also how you need to change your diet. Here are some options for that as well. So really understanding health overall, not just saying, hey, here's your issue, here's the pill, that's the solution, and that's it.
Yeah.
Yeah, absolutely.
Fear can be a problem.
Anybody else have a comment to it? Sir, I'm gonna pick one. You okay? I just wanted to kind of say on that for just a second longer. Any 3 to 5, challenges that UT Southwestern might face when trying to interact with people, trying to get outreach done, trying to take care of preventative wellness, whether it's anything like that. Anybody else have a comment on it? Language. As far as
Speaking different languages.
speaking different languages. Making sure that staff is multicultural, diverse, speaks multiple languages. Okay. Let's move on.
Can I add something?
Yes, sir, absolutely.
And this is just a question to the group, and we talked about access to care, and some of the things we did out west was move care outside of the traditional exam room. So my question would be, when we talk about barriers with technology, having a technology piece, care outside of traditional, would that be intimidating to the community? Or would that be accepted, i.e. video, phone visits, e-visits? Would that be something?
That's a great, so you're saying using
Technology.
to access them in their homes and talk to them about.
Correct.
Like maybe setting up a video.
I mean, you could have a whole visit.
Right,
So
absolutely, through like a FaceTime or something
I
like
think that would be valuable in this community, because then I don't have to find a babysitter. I don't have to, I don't have to worry about getting on the bus and waiting up 45, I think that would be like some telehealth or something like that.
So
Like,
given the option, you
yeah,
would use it?
I think it would be very useful.
All right.
Yes.
Well, it depends. It depends on the household, because if it's a household of seniors, 9 times out of 10, they're not going to have internet. Now, in retrospect, I don't want to be seen by a psychologist via Skype. To me, the whole humanistic part of it is essential. You can't touch my stomach and feel my lump via Skype. In my opinion, I would like it live.
And I think that like, let's say you're having a medication follow, or your medication plan, something like that, like something like what you're saying, definitely face-to-face. But if you want to do a medication follow-up, I already have my appointment. You prescribe the medication, you want to know how it's working. I don't need to jump on the 404 and come back over here to tell you I'm itching now. We can do that over the phone, like, or telehealth or whatever.
Right.
And also, I don't have to round up all the kids or make all these other accommodations that it would normally take for me. So I think I still think it would be valuable to the community, but of course it would depend on what the medical issue is and your patient.
So in particular situations saying, hey, we can do this over the phone or on Skype or, whatever other kind of video conferencing there can be. I think that's a great idea, and I appreciate you bringing up that.
Has anyone ever used it?
Has anyone,
Anyone ever, because I used it for the first time. Yeah, and it is, because to her point, it's very easy. I think I came from Houston, and I just thought I had like the flu or I was dying. But I used the virtual, and she was like, oh, bad sinuses. She prescribed me something. I went to the pharmacist that night, got it, and felt better. So the reason for asking is, if you've experienced, it's not much of a disconnect, even though you're not physically there. There is some personable, they do ask questions until they can definitely, and then actually kind of examine you over the phone, which is really cool.
Well, and the key is to be comfortable.
Mm-hmm.
And also to be educated. Before you do it, how do I be educated? So therefore, it had to be a way of me to educate the patient. When a doctor comes in for their first visit, they said, I gave you the medicine, you come back in 3 days, you come back, you don't have to take no blood sample, all they gotta do is say, how was the medication working? That's a simple phone call. Hey, it look good, then look at it. I see you, fine, move on. But I think it's a great tool to use because we need to put every tool in the toolbox. Because some people might not use, some people might not use it. So if the seniors don't want to do it, we need to train the seniors to show them how to use it. So it's also trained also by education. Medicine is more education now.
So I had a kind of follow-up question. Does anybody else have a story or similar experience to that Juanita Craft experience that they want to talk about? Yes, sir.
Just a bit of what you said.
Right, absolutely. Does anybody else kind of have an experience like that? Yes.
Ditto on what she said. I'm a community health worker, like she's been speaking about. I'm actually a community health worker instructor, and I got my start at the Juanita Craft Restoration Center, so I'm very familiar with that location. It's a joint venture with Baylor, Scott & White in the city of Dallas. They started because diabetes is an epidemic proportion in our community, and their emergency room at Baylor was just inundated with people who were coming to the emergency room to get treatment for diabetes complications. And that's happening all over our city, especially with our people. And by that Health and Wellness Center being there, patients are now getting education. They're getting their wellness checks there in the community. In addition to the resources that she mentioned, they also have a food pantry. And that area of Dallas is a food desert. This area of Dallas could be considered a food desert as well because we don't have very many grocery stores and services. So I think that if UT Southwestern is coming here to have some type of community outreach, some type of community education, where we are meeting the needs of the people in that facet, that will get them to come in for their preventative services, for their complications of diabetes. We need an ophthalmologist and optometrist here because blindness is one of the leading complications associated with diabetes, second to amputations. So we definitely need that in the community since this is one of the zip codes that has the lowest health rates.
Right. So I heard a couple of things, and the types of services that they need, and then also understanding that thinking outside of the box on how a medical clinic works as well.
Correct. As he was stating, a medical home,
Right.
when you have healthcare services, your primary care physician is the head, but you have a care team. And people need to be educated on how that care team works with the primary care physician to provide the best overall care for the patient. And it's a lack of education. And we talked about a lot of things, and everything is applicable. It's not one solution. The teledoc is applicable as well as having in-service care. The community health worker doing home visits, as well as someone stationed in the churches to get the word out. It's all applicable and it's all needed. If it's going to be a success and we're going to bring people in the way that you're wanting to, you're going to have boots on the ground in all areas and willing to listen and reformulate your plan as you go by. The people will let you know what they need. They will let you know. They have no problem letting you know what they need. So I think that's the main thing, is to have an open mind, to be willing to think out of the box. UT's motto is the future of medicine today. So that says to me, technology. So you have to be willing to commit to building apps, to commit to utilize the patient portal, MyChart, to reach more people.
Absolutely. Great comments.
Thank you.
I looked at Dr. Warner, so I like people that know our motto. Too. Okay, you bringing up diabetes made me think about another point. So let's try to talk about some services that you might need. Let's try to create like a little top 5. Let's say diabetes is on that list. What else is on that list?
Heart disease.
Asthma, Parkinson's, I heard?
Heart disease.
Heart disease.
Yeah.
Heart disease, okay. Asthma, diabetes.
Prenatal?
Prenatal.
Maternal health all around.
Maternal health all around, absolutely. What about cancer research?
Yes.
Or cancer in general? Cardiology, I don't know if that's a problem. Just in general, anything that goes on.
Where would high blood
That's
pressure
why I got
fall?
doctors in the room. Yes.
One of the first comments that was mentioned was behavioral health.
Right.
Mental health is a taboo topic, so we need to find ways to make it more comfortable to speak about in our community and get more education out there.
Right, absolutely. So asthma, heart disease, now I'm blanking. Cancer, prenatal, maternal care, just in general, right, right. Okay, great. I just wanted to hear it again for the camera. All right. See, I'm doing this. I'm doing it. Okay. I've only got a few more. I just want to go over some of these. So what do you think are some of the best ways to let people know about the kinds of doctors and medical services? So we went over that, a little bit of outreach, reaching out to people in the schools. Any other ways? I just want being very creative about that.
I think that this community has so many organizations already. And I mean from Cedarville, Duncanville, DeSoto, and then Southern Dallas.
Right.
And I think that the best thing we can do is find out who those people are, and partner with them.
Tapping into the resources
Tapping into
that
the
are already
resources
here.
that already exist,
Right.
and then partner with them.
So it's on that communication as well. Like, you know, if you're going to have the best overall hospital, making sure those communication lines are correct so that the service to the person, not the product, is correct as well.
And
It's
also the
the
churches.
best.
Yeah, this area
Churches
has
is great.
1 million mega churches.
1 million is probably not an understatement.
But all the mega churches that are here, and they all have their own little clinics inside, and they all have their own healthcare initiatives that they are already doing. So I think UT Southwestern, it would be valuable and, beneficial if they partner with them as well.
We have to, creating a partnership with them, letting them know, hey, we're here to serve the people in this community, so let's work together the best that we can. We're going to provide the best services that we can, but we also need people to access those services, and we need people who already believe are the champions of the community to champion other causes as well. Because it's not just about faith-based stuff, it's about your health and other things as well. Anybody else have a comment about that? Yes. Come on.
This is labeled incentives.
Incentives.
I'm talking loud.
Yes. I'm gonna go stand over there.
Let's say Mr. Young here has a cardiac problem, he comes sees you, and he does everything Dr. Warner says do. He needs an incentive. He needs to get a gift card. He needs to maybe get paid for a membership to the Y or something like that. Every facility should have resource guides for the community. What City Hall has to offer, what other clinics are to offer, what health clubs are to offer. Just a resource guide for that zip code or the area around. And why not have a room, Perkins and Will, that could be used for multiple things. You can put exercise equipment in it, you can have eating in it, you can have the cooking demonstration in it. Well, that room is multi-purpose by design, so you can make it whatever you want. And if you get people flowing in there, from a sales perspective, once you get them in, then you got them paying, you can pay you. So you want this to be a business enterprise where you make some money. And you can do it if you get those people walking in the door. You're a captured audience, but we have to treat them that way. Well, take care of their illness, but they should come out better than they came in, health and non-health.
I agree. I hear that. I like this side room, this multi-purpose space that we're talking about as well.
I will say now that I have a silver sneaker.
Okay.
Anybody else have a comment toward that?
And when he says incentives, I'm just thinking I think be mindful of the incentives.
Right.
Like, because the incentive is, you just extended your life a little bit by finishing your medication. But partnering again, like you were saying that, if somebody comes in, he does everything he needs to do, then he gets a month free membership to the local Y, or to the local WellMed, or to like those things, where it's not like, oh, we got UT Southwestern out here giving out gift cards.
But if you partner with community organizations who are looking for ways to increase healthcare services, and the community people provided those healthcare gift cards, and then UT Southwestern said, hey, if you fill it out, you know. So
Yeah.
creating that ecosystem,
Yeah.
being very creative about that, to say, hey, what we're really trying to do is improve healthcare overall. We need you to provide the gift cards, we'll provide the medical services, all of that as well. So yeah, absolutely. Okay. Is there anybody you know who's not excited about UT Southwestern coming to RedBird? Who people are like, I prefer to drive 30 minutes to go to the clinic or whatever.
I think there was some confusion in the beginning because you had this big announcement, Parkland is coming to RedBird. UT Southwestern is coming to RedBird. And it's like, are they competing? Are they going to be complementary services? Like this specialty and this is primary? So I think that would be good if we just understood what's, but I know everybody's still in the stages of even figuring out what services are going to be offered. But I think that caused a little bit of confusion in the community.
Having both here at the same place. Well, yeah, I definitely hear you on that. Or about the confusion between the two, but I also know that there's excitement because now we're just making it more available, more healthcare services available. You know, Parkland or UT Southwestern. Thanks, Parkland. Appreciate it all. So,
I want to add one more thing.
yes.
Massage table.
No, I don't think you are, but I want a massage. We put it down.
Keep working on it.
Aromatherapy.
Wine, bottle of wine while you
I understand that. You don't like the chairs that are out there right now? They don't rub you down? Something like that.
red or white wine.
Okay, just the last comment that I wanted to make is I wanted you to know what information you had in front of you. So they have a cancer community meetings that are coming up. So that's that information there for you. Of course, it's the Dallas Morning News article there about UT Southwestern coming to RedBird. If you haven't filled out your questionnaire, it's a really quick questionnaire, so we'd love for you to fill it out, and then we'll just leave it there and we'll pick it up. And that's the end of the questions that I have, but I am going to let Councilman Atkins, yes, miss, I apologize.
I literally just came here because I want a birthing center that's going to set Medicaid and it's going to serve women of color and give us knowledge so that we won't get cut. So we won't have a C-section. That's literally the reason why I came.
Well, I'm glad you were here. I appreciate it. And I'm glad for all you coming here, Councilman Atkins.
Well, I just want to do one thing before y'all leave, run out. Everybody from UT Southwestern and Park House, please come up. I want you to introduce yourself to the people. Come on, don't be shy. You know, everybody with UT Southwestern and Park House, all the staff, come up here. So we got a group, so I want you to tell them who you are. It's very important that they came out, so you need to put a name with a face and what they do, right?
Right.
Right?
Right.
Okay, just come right here and start, tell who you are and
okay.
who you with.
Marcia Schneider with UT Southwestern, Chief Strategy Officer for the Clinical Enterprise. Thanks for having us this evening and for coming.
Hi, my name is Bob Toto. I'm a kidney specialist from UT Southwestern in the Department of Internal Medicine. So I fall into the specialty clinic arena, and I also want to thank you all for coming out. I learned a lot too, and I really appreciate the comments from you here in the community about what we can do to help.
Hi, I'm Jasmine Curo. I do community outreach and engagement for the Simmons Cancer Center. The flyer that you have in front of you is from my team. We'll be back here on February 22nd, that's Saturday at 11 a.m. to hear more about what your specific needs are around cancer and also share more about the services that we offer around cancer. So I hope to see all of you back here and hope to share that with your other friends and family members.
Hi, I'm Nancy Rollins, and I'm one of those specialists. I'm a pediatric neuroradiologist, so I do those MRIs on the kids, mostly for brains and spines. At this point, most of the time I'm over working to build clinical research at UT Southwestern, so listening to you people. Some of us are going to be back to talk to you about how can we build research programs that address the needs of
I'm Kate Wilkinson. I work with Dr. Rollins on programs to increase the number of research participants, the number of people to participate in research studies at UT Southwestern.
Ahmad Garrett Price, family medicine physician from the community, DeSoto graduate, Morehouse graduate, practice in California, Oakland, and I'm kind of back, hoping to be involved in this project as it grows. My father was actually a physician in this community for many years, so very enthusiastic about seeing this connect and really, you know, see the vision through. So.
Hi, I'm Sandy Pruitt. I study why some neighborhoods are healthier than others. I work very closely with the North Texas Food Bank and Crossroads Community Services over here at Cockrell Hill as well, to help make sure we can give enough food to the right people to improve their health.
Hi, I'm Diane McGee. I'm from the Office of Communications, Marketing, and Public Affairs. I just want to thank you guys for being here tonight.
I'm Jessica Hernandez, and I'm the Senior Vice President of Operations for Population Health at Parkland. So that encompasses all of our primary care clinics in Dallas County, correctional health, and all of our specialty clinics on campus.
Hi, my name is Carrie Roberts. I'm the Director of the Southern Region. I work for Parkland, and this is my area as well as my home.
I'm Vicki Henry, and I work for Parkland as well. I'm the Community Development Specialist for Blewett and Oak West, and I am from this area.
I'm Russell Ryan from the Communications.
Oh, sorry.
Yeah. Charlanda Thompson. I work for UT Southwestern also, and I'm a project coordinator in communications, marketing, and public affairs.
I'm Russell Ryan from the Communications Office, and I'm tasked with explaining in lay language what the doctors are doing.
Yeah, so if we're not doing a good job, let them know. Hi, my name is Audrey Wong. I'm the Associate Vice President for Communications and Public Affairs at UT Southwestern.
Patrick Waskovich. I work for Russell. I'm in communications. I live in Cedar Hill, so I'm excited as everybody else.
All right, Dr. Erica Williams. I'm an internist, adult medicine, UT Southwestern trained for rheumatology. I won't explain what that is. I'm a resident of the community. I'm thinking that this is going to be an excellent opportunity for all the parties involved, and I'm so excited to be here. But I work for Parkland right now in one of the COPC, Southeast. So.
And I'm Deborah Richards. I work in communications, and one of the efforts that I'm working on is helping to get RedBird going. So thank you all for being here tonight and providing great input.
Well, the reason why I want these people to show the faces, the care, and the passion they have. And they could do anything else this evening. They here, and they want to make sure that we want to welcome them here with a hand. But at the end, go back and tell something about UT Southwestern Parkland Hospital. We need them here, but we also need your input. We need to know what type of service that you need. They're here to help you. If you don't go back and tell the community, how can they help you? And this has been a great opportunity you will lose for the rest of your life. So embrace them, fill out the questionnaire. No question is a stupid question. Just come back and have a good time, okay? Thank you.